February is Heart Health Month, and UI Health is raising awareness of atrial fibrillation.
The hospital's specialized group of cardiologists focuses on helping patients with heart rhythm issues. Dr. Dana Johnson joins us with what you should be on the lookout for. Doctor, thanks for being here.
Yeah, thanks for having me.
Fresh off of surgery. What did you do this morning? I was in surgery.
I did not save someone's life, so I'll tell you that.
Amazing. So, doctor, you are a cardiac electrophysiologist.
That's right.
What does that mean?
Yeah, so great question. When I talk about heart doctors, and especially invasive heart doctors, I kind of think of it as there's plumbing and electricity.
Ooh.
The heart's like an electrical pump, right? It needs blood supply to make the muscle pump, but it also needs a spark to make it fire. So invasive cardiologists fix heart attacks with stents and things like that. We're the kind of invasive cardiologists that fix heart rhythm issues. So think of us as the electricians of the heart.
Oh,
yeah.
That makes so much sense. Thank you for putting it in layman's terms so
Yes.
we could understand it. And so from there, what is atrial fibrillation?
Yeah,
and we all know that as A-Fib.
Yeah. So a lot of people have heard of the word A-Fib. A lot of people have family members or themselves have A-Fib. A-Fib is an irregular heartbeat that starts in the top chamber of the heart. There's a lot of different extra heartbeats people can have, but sometimes an extra heartbeat can trigger off a very fast, irregular heartbeat in the top chamber. When that happens, the heart tends to race a little bit, and it doesn't pump as effectively. Over time, this can cause extra stress on the heart and lead to other risk factors like stroke from blood clots and things like that. A-Fib is the most common heart problem that we have in America as far as rhythm issues, and it can lead to an increase in stroke risk up to 3 to 5%, or 3 to 5 times those without A-Fib.
Oh, wow.
Is this something that when it's happening, you know what it is? Or if you've never felt it before, what does it feel like?
Yeah, that's a really great question. A lot of people do feel it. They'll feel their heart beating irregularly or racing. Sometimes they feel short of breath.
So it's not just one weird beat.
No, right. A lot of times it'll kind of keep going. It'll sustain itself. But a lot of people, up to 50%, even if they do feel it sometimes, don't feel it all the time. And a lot of people don't feel it at all. So sometimes it's found incidentally after some of the negative impacts that can happen from it, like stroke or stress on the heart, like heart failure. Yeah.
I think the hard part is knowing, when is this bad enough or worrisome enough for me to go to the ER or call 911, and sometimes we're like, oh, well, we're stressed, or I've just been running around, or
and that's really important. I think that with issues of the heart, and everybody knows this, when you have something with your heart, it's best to be cautious. So if in doubt, it's best to get checked out, right? There's always a wide variety of things that can cause some of these symptoms, like shortness of breath and racing heartbeats and palpitations. Anxiety can do it, stress can do it. But at the end of the day, if you're having these symptoms, they're causing these distress, it's best to get seen by a doctor that can further sort it out. Sometimes it's as simple as just checking your pulse and checking an EKG, things like that that are not going to hurt you. They take a few minutes, and if it all looks okay, a lot of times you can go home and follow up with your doctor and things like that. Other times, it may need you to be seen by a specialist like me. And so some of these symptoms, it is important to get checked out. If you've never had it before and it starts happening and it's something concerning, those symptoms happen, chest discomfort, shortness of breath, it's best to get checked out.
So then what happens at that point? I come see you at UI Health and you determine that I do have A-Fib.
Yeah.
What happens from then?
Yeah, so we actually have like a specialized pathway that we take care of our A-Fib patients, where you'd get routed to see one of our specialists that is, like me, a heart electrical doctor. And we can provide a wide array of therapies, from medicines for people to stroke prevention as needed. And for some people, it's going to be a minimally invasive therapy where we can actually go in and treat the A-Fib using minimally invasive catheter therapies that can help reduce the burden of A-Fib. And in some instances, get people off the medicines that otherwise in the past they've been on for the rest of their lives.
And part of the goal is just you want to prevent people from even having to come and see you. So what are some of the tips you can give everybody?
Yeah, so this is where I get to be a little bit of the wet blanket.
I know.
I just saw the segment where everybody got a tequila shot on Friday. So,
I don't know what you're talking about.
Right?
Don't ask us how many drinks we have a week, doctor.
So broadly speaking, when patients come to me and they do have a diagnosis of A-Fib, I'm going to tell them that we want to limit or eliminate alcohol. Stopping smoking, just like any heart health issue, is really important. Weight loss and exercise is very important. There was one study in Australia that showed that losing 10% body weight can be as effective as our antiarrhythmic drugs that we sometimes use to control A-Fib.
Wow.
So
Whoa, that's huge.
Yeah, it's huge, yeah. Exercise is really important for all heart health, but heart electrical health, it's important as well. So it's not all just medicines and procedures and things like that. There are things you can do to better control your A-Fib and better control your heart health.
Okay, well, thank you.
Yeah.
We really appreciate it.
Yeah, of
For
course.
more
We got a
information,
slap on the
I know,
wrist
we
from
sure
the doctor.
did. We don't smoke. That's good. All right.
Yeah.
For more information, just head to heart.uihealth.care or scan the QR code on your screen.